Hello and welcome to the COMLEX Instant Review. Let's talk about Giardiasis. Mainly affects the duodenum and the small intestine. On the board exam, the keyword is duodenum. Most common intestinal parasite in the US, so you have to know that it affects children in daycare and contaminated water, travelers to certain areas. So what happens here is that the cysts are ingested and the trophocytes are produced in the duodenum, and they attach to the brushboard or the duodenum and the jejunum, and as a result of this they actually reproduce by binary fission and are passed down the intestine and finally into the stool. The most infectious types are usually asymptomatic, and they have an acute limited diarrhea with low-grade fever, nausea, anorexia, and um, you know patients do present with cramps, bloating, weight loss. Stools initially watery and then greasy, foul smelling. Um, that's a key sign. They don't contain blood, mucus, or WBCs. That's a big giveaway for giardiasis. May have malabsorption, and again, diagnosis is stool enzyme immunoassay. So don't select stool, don't select other causes that we had talked about for malabsorption, such as the 72-hour fecal fat, things like that. This is specific. You want to get the ELISA, stool enzyme immunoassay, or the direct fluorescence antibody. So that's the key, EIA or direct fluorescent antibody. And if it's negative, then you do a biopsy or an aspiration of the duodenum. And the treatment here, again, a high yield point that you definitely want to remember the name for. Tinidazole. Again, tinidazole or nitazoxanide. Okay, these are the two main medications. Remember tinidazole or nitazoxanide. That's the other one. A little bit hard to pronounce, but again, keep in mind the names of these medications. So let's review giardiasis quickly. We have a patient who presents with a setting of daycare, contaminated water, travelers to certain areas such as a stream of water, things like that. It affects the duodenum, and patients come in with acute limited diarrhea, cramps, bloating, weight loss, watery stools, then greasy and foul smelling. But again, no blood, mucus, or WBCs, and they do have malabsorption possibly. Diagnosis by stool enzyme immunoassay or direct fluorescent antibody test for giardiasis. And the treatment is going to be tinidazole. Okay, tinidazole is the treatment. Please visit comlexflashcards.com for additional board review lectures, and good luck in your preparation for the boards.